Deep concerns over a potential bird flu outbreak as the Trump administration's FDA has fast-tracked the designation for a potential bird flu vaccine. That's right, ladies and gentlemen. As the media continually reports that we are on the verge, we are on the cusp of a major bird flu pandemic, the HHS and the FDA are working hard to make sure there will be a vaccine available to you. It's a good sign showing the Trump base that Donald Trump and RFK Jr. are listening. They care deeply about your thoughts on the matter. Now, I'm being somewhat facetious. Largely, among the Trump cohort and RFK Jr., the issue is more so mandates, not the creation of vaccines. As I've long maintained, I literally don't care if they produce vaccines. I mean, there's a question of how they're spending our tax dollars. The question is, are you going to force people to get medicated? Which makes no sense. Yeah, that's no good. If a doctor you trust advises you on a medical practice, then by all means, trust your doctor or don't. That's up to you. There's always a second opinion. So if the government is going to issue this grant, what I'm seeing from most Trump supporters, or I should say this approval, is, yeah, we don't care. Just as long as they don't force people to take it, you can make whatever you want. In fact, some are saying, good, let them make the vaccine. And then people who choose to get it can. Still, there are many people who are skeptical of mRNA technology, and more reports are coming out that are at odds with the official narrative during the Biden administration and even the Trump administration as it pertained to Operation Warp Speed. The question then is, what will Trump supporters think of this latest effort, and will they be okay with it? Well, we have this first. We've got the Arcturus Therapeutics press release. They say, Arcturus Therapeutics Holdings, a commercial messenger RNA medicine company focused on the development of infectious disease vaccines and opportunities with liver and respiratory rare disease, today announced the FDA has granted fast track designation for the self-amplifying mRNA vaccine candidate, ARCT-2304, designed for active immunization to protect against disease caused by influenza A, H5N1 subtype contained in the vaccine. This designation recognizes the potential of ARCT-2304 as an innovative approach to address unmet medical needs for the prevention of disease caused by pandemic influenza A virus H5N1, a significant global health risk. The phase 1 clinical study initiated November 2024. We also have another story that, let me see, where do we have this one? I forgot which one it is. This one, here we go. Yes. HHS awards $590 million to Moderna to develop mRNA vaccines against pandemic flu threats. January 21st, the day after Trump got in. Now, I imagine the existing HHS at this time was still Biden's HHS. It was a transition period. The point is, we can see an overlap between the two administrations, at least for now. It could be that holdover personnel are prioritizing this. Maybe RFK Jr. agrees. Again, me personally, I don't care if they want to fund research, fine, whatever. It's the mandates I have a problem with. If a doctor tells me, and this is what happened to me, during COVID, my doctor said not to get the vaccine. This is what really pissed me off about the narrative from liberals. I called my doctor, and they said, you're young, what do you need it for? And I was like, okay. They were like, how old are you? And I was, 34, 30, or 35, 36 at the time? Actually, I think 34. And they were like, yeah, you definitely don't need this. And I was like, okay. This was, I'm sorry, this would have been 2021. So I was probably 35. They were like, let older people who need it get it before you. Don't take a spot. You're fine. I did end up getting sick. And I got monoclonal antibodies treated for it. The funny thing is the left lied and claimed that I denied COVID existed. It's so weird. They write articles claiming this stuff. It's nuts how they lie about everything. Amazing, isn't it? Harvard.edu writes, are we on the cusp of a major bird flu outbreak? Scientists weigh in on the spread of H5N1 and highlight clues that portend what might come next. They say avian influenza has been circulating across North America since 2022, infecting birds, livestock, wildlife, pets, and humans. Despite 70 documented human cases, there are no known instances of human-to-human transmission. But some scientists are starting to worry that it's only a matter of time. Experts from the Harvard Medical School-led Massachusetts Consortium on Pathogen Readiness, or MASS CPR, answered questions on March 5th about how H5N1 is spreading and evolving and discussed the state of surveillance efforts, testing, and vaccines. Quote, I think we're all wondering whether this is a minor blip or if we are facing what may turn into an existential threat, said Bruce Walker, director of the Reagan Institute of Mass General, MIT, and Harvard, and a member of the Mass CPR Executive Committee. They go to mention several individuals who were involved. Harvard Medicine News asked, what do we know about the history and evolution of influenza viruses, specifically H5N1? I'll skip over the first bit on the flu. And this is Jeremy Lubin, a professor of molecular medicine, who said, a highly pathogenic subtype of H5N1 was first detected in birds in China in 1996. And the first human cases appeared soon afterwards. The virus diversified as it replicated in birds, and migratory bird species spread multiple subtypes around the planet. Avian influenza came to North America in 2014 and caused a severe outbreak in U.S. poultry. But the outbreak was controlled, and luckily the virus disappeared. Up until 2024, there have been almost 1,000 documented human cases of H5N1 in multiple countries, with a fatality rate of about 50%. In 2022, a new subtype of H5N1, clade 2.3.4.4b, emerged in North America and spread to domestic poultry and many wild mammal species. Over the past year, this subtype of H5N1 has also been spreading in dairy cows. Overall, when H5N1 has a long history, it says H5N1 has a long history of transmission through multiple bird and mammal species worldwide, and the virus has undergone massive diversification into multiple genetic subtypes. The jump into dairy cows is new, and we don't really know what the implications are yet. We've been monitoring the spread to humans, and most cases have been mild so far. There's been no evidence of human-to-human transmission, but there has been human-to-cat spread, which suggests that humans can transmit the virus. The question, of course, to what degree is this serious, or are they just trying to freak us out? Now, I don't know that Donald Trump would institute some kind of lockdown plan or mass mandates, but let's be real. 2 weeks to slow the spread started under Donald Trump. He trusted some bad people. So our hope is, in the event of an actual pandemic of any kind, people get the choice. But then it's a rock and a hard place, my friends. It seriously is. Many people will die. They will choose and they will die. And that's their choice, right? During COVID, the mortality rate, I believe, was around 0.2 to 0.4. Let me make sure I get this number correct. What was the death rate for COVID-19? I believe it was 0.2 to 0.4. 0.2% or zero. So it was, they said that the infection fatality rate was 0.27%, which is, it's double the standard flu. It is bad. But it should be up to the individual to decide, I'm going to go outside and take the risk as to whether or not I get sick, because this was not a 50% mortality rate. Now, the concerns early on was that because the virus was novel, meaning people had no immunity to it, you would get infected. You were going to get sick. It's not that it was going to kill you, but you would get sick. And that would increase the amount of deaths across the board. Point two, that can be a lot. I mean, if you've got, let's say, 2,000 people, 27 would die. So and there's more than that walking through Times Square every single day, that's a decent amount of deaths. That's a lot. So that was the mentality, but people should still have the choice. Many people would stay home and mask up. Some would choose to mask up and go outside, whether it worked or didn't, whatever. It's their choice, right? The concern about a bird flu outbreak, if it did reach this degree, 50% mortality. That's no joke. The thing is, humans have varying degrees of immunity to influenza. And this is influenza, so it's not novel. Its spread, so far, has proven it ain't going very far. Now, they're fast-tracking this vaccine, and the concern people have, of course, is whether or not it will be mandated. Some don't like it, the technology at all, fine, whatever. Ultimately, I say this, without joking. I'm curious what the statement from RFK Jr. and the Trump administration will be as to the fast tracking of this. RFK Jr. was called anti-vax, but now he's calling for people to get the measles vaccine. And we knew he was never anti-vax. He had concerns about the degree of testing in vaccines. So I'm not surprised to see that they are in favor of mRNA vaccines. However, a fast track, I thought RFK Jr. wanted rigorous testing. Fast tracking is the inverse of that. I don't think there will be a bird flu outbreak, but I don't know. There are powerful forces that hate Donald Trump and don't want him to succeed. So I suppose we'll see. I'm going to wrap it up there, my friends. Stay tuned. We got more segments coming up for you throughout the day. And follow me on X and Instagram at Timcast, and we'll see you all in the next segment.